David Rittenhouse, as Jim has told us, was one of his really good friends, also an aviator, and also his doctor. So why don't you come on up, David?
So I've known Jim since about 1997 when we were in the Civil Air Patrol together. And if I had to pick one word to describe him, I'd say it's positive. I think it's hard to pick one word for Jim, but if I had to, it'd be positive. The family asked that I just talk for a few minutes about colon cancer, and I know Jim would want that also, because people have misconceptions and so forth. Colon cancer is very common. It's the second most common cause of death from cancer in men, the fourth most common of death for cancer for women. The age of it, usually the way we look for it is to screen for it. So the recommendations are when you're 45, you start your screening process. And that's in different ways. One thing, you go to the doctor, they do an exam, they can take a stool sample and check to see if there's blood in the stool or chemicals that would indicate cancer. You won't see the blood necessarily with the naked eye. And then you should have your first colonoscopy, which everybody, wants to try to avoid, but it's not that big of a deal. The prep, is kind of a hassle, but you go and you go to sleep, you don't feel a thing. You have the scope done, and then it's recommended to be done every 10 years until you're 75. If there's a history of cancer, colon cancer in the family, then you need to start screening a little bit earlier. The reason all this is important is, why do people get cancer and how does it form? Well, the cells naturally have a cycle they go through and cells die. Well, sometimes that gene quits working, so the cells keep living and they replicate and they replicate. And then what happens is it grows out toward the lumen, toward the opening of the colon. And that may take time. So the doctor looks in there and may see a little bump or a little piece of tissue hanging down. That's a polyp. Now, most of those polyps are benign, they're not cancerous, but they can be precancerous. And it could take 10 to 15 years for that little polyp to turn into a cancer, okay? So you would not know that necessarily, but by screening, you would allow them to detect it earlier, to go in. People always think that they'll have some type of a symptom. Symptoms of colon cancer may include, constipation, a new onset constipation, worsening constipation, feeling bloated, feeling like you don't empty your bowels well afterwards, or blood in the stool. So if you see any of those, you can't just assume that blood's because I've got a hemorrhoid, because it may not be. It could be that this little polyp is bleeding and it's cancerous. It may just involve going in and them snipping it off and not being a big deal. So Jim called me. He was getting ready to go on a trip. He was in Newark. He said, I think I've got a bladder infection. So I said, okay, I'll call you in something. He was worried that he'd be getting up, running into the bathroom every 10 minutes. So I called him in some medicine, and then I said, let me know when you get back how you're doing. Everything was fine. Maybe a month or two later, he called me again. And at that time, I said, yeah, I called it, another prescription. And I said, Jim, you need to come in. We need to get to the bottom of this. So he came in, stone normal exam, and I get a very thorough exam. Nothing at all abnormal, other than on his urine, he just a little tiny bit of blood, a trace amount of blood. Now, I can guarantee you 90% of doctors would have looked at that and just disregarded it and said, well, you're in your 40s, your prostate's getting bigger, it's benign, it's not cancerous. But, I didn't want to take that chance. Plus, him being a pilot, you could have a kidney stone or something like that. That would be really bad to have an attack while you're flying. So I told him, let's get a CAT scan just to be safe. Get the CAT scan. Then I get the report back. I had to go back and sit at my desk and compose myself before I called them. And I said, Jim, I called him. I said, look, you need to come in so we can go over your CAT scan report. Well, what's the show, Dave? And I go, you just need to come in. We can't talk on the phone. He goes, well, I'm getting ready to go on a 4-day trip. I said, well, you're going to have to cancel the trip because I want you in the office this week. So he did. He said he was actually on a gangplank and turned around and canceled the trip and came back. His CAT scan showed that he had about a 6-centimeter tumor that was in the lower part of the colon. And that had grown in and pretty much closed off the lumen of the colon to about the diameter of your little finger. And he had no symptoms at all, none, other than that little bit of blood. So we got him set up, with the docs at UT Southwestern, started chemotherapy, went to see Larai, the oncologist, who's very good. Came back and we sat down and talked. He goes, I don't know what to do. He said, they told me I have about a 10% chance of living maybe up to 5 years, if that long. And I said, Jim, you know, I know doctors quote that. I don't do that. I said, your body may not have read the book. So I think you should go for it and do the chemo and see what type of response you have. He had excellent response. You know, markers came down, tumor got smaller. That allowed them to do the surgery. And then as that went on, the new goal was, we need to beat this and get you back in the cockpit. So he always had a positive attitude. But I knew what he was going through was really hard. So I called him, I said, Jim, we need to go fly, because I had a Cirrus. And I said, no, I need to get my instrument currency or something, just to get him outside, getting him in the air. I knew would help his attitude. And it helped me because he's an excellent pilot, excellent instructor, and fun to be with. So, you know, we did that for as long as we could and enjoyed every minute of it. But I'd see him, you know, he had the chemo hair, you'd see rashes, his hands, you know, skin was flaking off, his fingernails. I knew, as a physician, I knew he was miserable. But he never complained, not one time the entire time. Craig and I would go to dinner with him about once a month. And they'd come in and we'd be like, oh man, he looks terrible. Big smile on his face, always positive attitude. And he, you know, I told him, I said, Jim, just keep that attitude, don't give up, you know, and he did. So I think the goal here from his standpoint would be to let you all know to get screened, because early detection is the key. And it's not a big process to go through. So don't assume something, you know, and don't think you're going to run from it, because you can run from it, but you're not going to hide from it. So it's better to deal with it up front and nip it in the bud than it is to let it grow and continue. And you can see his got so advanced, no symptoms. So that's it. Just my word for him is positive, and that's why. And it's, you know, he's one of the closest friends I've had for a long time and a wonderful person. Thank you.